Hi, everyone. Welcome to the next show, chest pain. A lot of people suffer from chest pain, and the chances are one day you or a loved one will have chest pain. And what we're going to talk about as two doctors who see chest pain fairly regularly, we're going to talk about the more common causes and some other causes of chest pain that you should also know about. And for those of you who enjoy our discussions, make sure you signed up for our separate, unique channel down below. Please subscribe, link in description, where we have a lot of exclusive content going out related to your health and well-being. Okay, so let's talk first about the heart causes of chest pain. So we do have our cardiologist here who will expand on this a bit further.
Sure, Suneel. This is probably half my day, every day I spend on chest pain. So, chest pain is really interesting because you'd be amazed on how many different things can cause it. And really, the thing I want to drive here is that not all pain is a heart attack, or not all chest pain equals a heart attack, but you never want to wait it out. And so the important thing is always get it checked out, even if sometimes you think it's wasting someone's time, or you'd be surprised on how chest pain can mask as very different feelings that are really not classic. And so the one I see the most, obviously, is chest pain coming from what people think is their heart. And so it's usually left-sided chest pain radiating down to their arm. I really use chest pain as a loose term because it actually can mean so many different things. So chest tightness, a heaviness, a feeling of pressure, classically like someone feel like they're sitting on their chest. Sometimes, in other people, it's not necessarily chest pain, it's heartburn like feelings. And so angina is really what I focus on. So it's chest pain that's exertional in nature. So if you think about your heart as a pump, and so when it's pumping normally, it doesn't require as much blood supply. And so as your heart accelerates with its heart rate, just like an engine, it requires more fuel, it requires more blood supply. And so if you're having exertional symptoms, so chest pain with exertion or shortness of breath, chest tightness with exertion relieved with rest, that's really worrisome. That's really a red flag that it really could be a heart.
Okay. Yeah, thank you for that explanation. And basically, that's the number one thing, as I'm sure you already know, that anybody is concerned about when you experience chest pain. So, Dr. Peter, you are saying that chest pain, which is left-sided, which makes sense, which is where the heart is, which goes down the arm, perhaps up to the jaw as well, is a concerning type of chest pain where you should definitely seek immediate help if that happens.
Yeah, it's so true because there are so many manifestations of this. And I think that different groups of people and different people express it to chest pain differently. So we know that diabetics classically may not have the chest pain that you see on TV with left-sided chest pain with radiation down the arm. We know that women sometimes can present with jaw pain. And so that's always one thing. And that's when I use the word chest pain really loosely because it can really mean so many different things. But exertional symptoms is really what you want to focus on. So exertional jaw pain, or some people feel like the tightness in their jaw, or like they feel like they clench their teeth all night. Exertional heartburn is really important. So heartburn not related to food can be very worrisome, especially if you walk and you get heartburn.
Interesting.
So, yeah. So, I mean, and I've seen a lot, and women can be underdiagnosed with it too. And I've seen patients that have come to me and they've been treated for heartburn. They've had endoscopies. That's a scope that looks in your stomach. And I have a couple of patients that you won't forget, these patients that was having heartburn. But when you really talk to the patient, this is how it's so important to really take a good history from the patient, is that it was not related to food. It was exertional. This patient ended up having a cardiac catheterization or angiogram for exertional heartburn, and it wasn't heartburn. Right? This patient had severe coronary artery disease and ended up with bypass surgery.
Wow. Yeah, so what you've talked about there is crucial. Basically, we worry if chest pain is coming from the heart, it means that not enough blood is getting to the heart muscle. So those arteries that supply the heart muscle are blocked, and that's what's causing the chest pain if you have that type of pain. I often find it's described as a heaviness, like you said, someone sitting on your chest. That's when you should urgently be evaluated.
Absolutely. It's a pressure. It's just a feeling of someone sitting on your chest. So if I have a patient coming in and doing this to me, that's always a red flag. But it really, the people that get hurt the most by it are the people that don't get it checked out because they just thought that it just is not their heart.
Yeah, absolutely. And I made a video not so long ago about how one of the biggest red flags for me when I see patients And this is a very common occurrence. You have the husband there with the wife, and the husband will say, my wife made me come in for this pain. And that's a huge red flag. The amount of times that we've ended up investigating that and it's ended up being from the heart. Men, for whatever reason, we can talk a bit more about that in another podcast, tend to wait and not want to go and seek help. But these are red flag signs. So yeah, absolutely, that type of pain, get checked out, can be associated with shortness of breath as well. And in terms of other differentials, so obviously that's the number one thing to worry about, but there are many other structures ranging from your muscles, your bones, your gastrointestinal system, your lungs even, where the pain could be coming from. Do you want to speak a little bit more about heartburn, which mimics chest pain and often ends up leading to cardiac tests?
Yeah, and I think my main distinguishing factor that I usually start with when I see patients is it exertional. And
Great
again,
question.
it's a whole supply-demand mismatch. I mean, if you're someone that's having heartburn after you eat food and clearly related to that and does not happen when you exercise or walk upstairs, then the pretest probability or the likelihood of that being your heart, it can be a lot lower.
Yeah.
And so, but heartburn, is interesting because it's really a confusing and sometimes difficult diagnosis. And so heartburn can be true heartburn. All right. And it really depends on who you're speaking to. Is it someone in their 20s or is it someone, above the age of 60? We do know that certain things are more prevalent when you're older. So if I have a younger 20-year-old coming in with heartburn, it's probably more likely heartburn. But I don't, just because someone labels you as heartburn, just don't think that it's definitely heartburn. If it doesn't feel it, you know your body the best. And I think that's don't hold back when you see your doctor about telling them symptoms, because sometimes it's just little subtle signs. I had a patient that was just saying feeling great, but then randomly just brought up the fact he was with his grandkids, and he said his grandson was running away from him, and he chased him, and he felt like he had heartburn. Now that raised obviously a red flag. He went for a cardiac catheterization and ended up getting a stent, very, very tight blockage in his artery.
Very interesting. So saved his life, yeah. And a very common scenario that I see is someone will come in with chest pain, and this is very common in hospital medicine. We will then admit them and they'll have a cardiac stress test. It could be usually as a nuclear myocardial perfusion scan, which looks for heart muscle, which is short of perfusion. And if that's positive, then they'll go on to have a heart catheterization. So yeah, it's very interesting about the heartburn. I have encountered that a lot where somebody's investigated and then they end up having something like gastritis, so inflammation of the stomach, or a stomach ulcer. That's one differential. Let's talk a little bit more about muscular, because you've got your muscles and bones there. Do you see a lot of cases where chest pain end up being something which is musculoskeletal or a nerve-related pain?
All the time. And so, musculoskeletal.
Skeletal?
So really, when I see someone, if it's positional pain, if you can make it worse by changing position, it's non-exertional and, especially reproducible palpation or pressing into your chest. I mean, it's very rare that people with chest pain from the heart can usually localize it to one finger. There's a small percentage of people that can, but it's usually more diffuse. So, that's really important. And people are often in disbelief because sometimes, as you said in the beginning, that most people experience chest pain at some point. Right. And so it's really important to differentiate it. And it comes down to musculoskeletal pain usually is positional in nature, worse when you take a deep breath in because you're stretching out your rib cage. In between your ribs, you have tons of muscles. So that inspiration or that deep breath in causes something called pleuritic pain. So it's just pain worse on inspiration. All are signs that it could be musculoskeletal.
Yeah, that's what pleuritic means. It means pain that's worse on breathing. I'll tell you it's not so uncommon that I've seen people come in with chest pain and it ends up being the start of an outbreak of shingles.
That's true. And
I've seen that a fair number of times, actually. Shingles, which you're all familiar with. Yeah. So that's on the skin. So let's get deeper down. Lungs. Could lung pain or inflammation or even pneumonia, lung infection, cause chest pain?
Yeah, and that goes back to what we talked about with pleuritic chest pain. So it's that pain on deep inspiration. Usually it can be non-exertional. And so it's classically when someone has infection in their lungs or when someone has a pulmonary embolism, that can cause chest pain as well. And
good point. Yeah, blood clot on the lungs. So these are all the differentials. So yes, we wanted to make this episode to really emphasize that chest pain, especially if it occurs above a certain age, should definitely be investigated. And ultimately, you know your own body. And usually what I find is people have a very good knack. Trust your own body. If you have some unusual pain and you know it's not right for you, as much as I completely understand that you distrust the system, I do too. There are some situations where you should absolutely be checked out. And if you have an urgent issue, it can be reversed. I mean, the amount of times that I've seen people come in and it doesn't even sound that bad. And then they'll have a cardiac catheterization and they'll have a left anterior descending lesion, which unfortunately, shall we mention what it's called? The LAD lesion.
Yeah, so what we call as a widowmaker.
It's really sad. It's called a widowmaker because so many men were well known to just suddenly die from this issue. It's terrible. But fortunately now we have other options and we can go in and stent it, clear it, and then hopefully people can work on lifestyle, optimizing metabolic health as well.
That we say in the cardiology world, time is myocardium or time is heart muscle. And so the longer you ride out a heart attack, the more damage you get to your muscle. And so, and hospitals are gauged by something called door to balloon time. So it's the minute you enter the emergency room until the minute they inflate the balloon in the catheter to open up the artery has to be as quick as possible because the more lack of blood supply to the muscle over a longer period of time causes muscle damage. And a lot of times it's irreversible. And so really the common mistake I see is waiting it out instead of getting checked. Sometimes it's just as simple as that.
And I mean, to a large extent, we get that. Nobody wants to go and seek medical attention and go into a hospital, but there's some circumstances, and you will know, you're all very smart watching, if there's something wrong, go get it checked out. It's really worth doing. And then afterwards, you can work on minimizing risk in any other way. But heart attack, you definitely don't want to take any chances. Okay, everybody. Thank you very much for watching. We do hope that was helpful. Check in the links down below once again for our separate channel where we post a lot of these exclusive discussions and also our natural health and well-being store, ohighwellness.com. If you're in the USA, North America, ohighwellness.co. If you're in the UK, Europe, please keep going, everyone. Stay strong and we will see you in the next episode.